is the supply. And also the water to the body is very essential. Intake, we can intake proteins, fats, carbohydrates, vitamins, essential minerals and trace elements which are necessary for the biological life. And there is a table here where you can see the minimum daily requirements from each foodstuffs. And also every foodstuff has a nutritional value of dietary items. You can see here how many vitamins it contains, how many thiamines, so different kind of amino acids, different kind of, for example, apples, orange, bread, you can see here. Sometimes it's valuable to see who is a bodybuilder, you know, also see how many the protein intake and so on, and what kind of proteins, amino acids intake. Basically, it can be sometimes interesting, and especially in case of the lack of these foodstuffs can cause diseases, different kinds of diseases. Some components may be particularly important for specific tissues. Vitamin D is very important, for example, for the bone because of the calcium mobilization. You know that the calcium intake. Tissues in the oral cavity, basically which we have to talk about the dental tissues in the oral cavity. The oral mucosa it also shows sometimes us if some problem is there. For example, some vitamin, lack of the vitamin B, for example, you can see on the surface of the tongue, because in this case the tongue will be depopulated. So there are some manifestation, oral manifestation of these diseases. The connective tissue is very important, because if the collagen synthesis, because of lack of the vitamin C, it's not perfect, the connective tissue is abnormal. So can be the fracture of the so the venulas and arterioles in this case. Can be the bad wound healing in this case, if the connective tissue is not perfect. It's not in the normal case. Also the bone is very important if we are talking about the oral cavity. The mandibula and the maxilla also can have deformation if the calcium turnover is not good. The epithelium also is very important if we are talking about the oral cavity. Contact with dietary constituents during the feeding, this is the long action. When you eat, for example, if you eat acidic food, it can have an action on the tooth surface because it can solve out the calcium and phosphate ions, so it will cause demineralization. And also the very acidic foods and also the very spicy foods can cause mucosal irritation also. So this is a local action, absolutely. Post-resorptive, this is the systemic action. When you eat it, and in the small intestine, in the large intestine, intake and the absorption happened, after it will have a systemic action. Okay, so local action, systemic action, sign it. Okay, it can be also an exam question. What is the difference between them? Okay. Let's talk about that first, the proteins. Essential as a source of amino acid from which the body protein will be built up or replaced. The recommended daily, it's minimum 30 grams. Larger amount of may be necessary during growth, for example in case of children. In recovery from different kind of illnesses or starvation, when the body may have been losing nitrogens as a protein, was mobilized as an energy source. So basically in children, in case of hard work, it can be more necessary, but the basic in normal action is just 30 grams. Essential part of the oral tissues, particularly in the form of collagen. Collagen is very important because we can find collagen everywhere, in the connective tissue, also in the pocket, also in the Sharpie type fibers, it's from collagen. We can find collagen in the dentin, so development of the teeth, it's very important, the collagen, the normal formation of the collagen. also essential for the synthesis of immunoglobulins and other defense proteins. So you have to know that in the saliva we can find immunoglobulin. What kind of immunoglobulin we can? A, yes, of course. But the G is also very important. So the secretory immunoglobulin is very important because this is the first border for the bacteria. You know, when it's we eat something and some bacteria in the oral cavity, from the saliva, the immunoglobulin A can connect to this bacteria, for example. Yes, neutralize it basically. Yes, protein starvation more susceptible to dental caries, reduced resistance to infection, severe ulceration in the oral cavity. So especially the ulceration in the oral cavity, which is very, very good manifestation when the patient has not enough. But in the normal circumstances, it's not exactly happen. Rather, homeless people, for example, not eat enough and enough kind of foods. In case of that countries where it's war, in the Second World War was a lot of this kind of problem, you know, because no any kind of food stuff. Protein deficiency can be because of it the kwashiorkor, marasmus also, and acute starvation reduce the salivary flow. The salivary flow is very important also because the saliva is responsible for the oral protection, you know. It protects basically the teeth and also the oral mucosa. We can find the immunoglobulin A in the saliva. Also, it has a buffer capacity, as you learned about. So when we eat some acidic food stuff and the demineralization happen on the tooth surface, the saliva try to remineralize it because also it's a solution of the different kind of minerals. For example, calcium and phosphate. A lot of phosphate and calcium we can find in the saliva and can help to remineralize these lesions. It's very important. Also, when we eat the saliva, it's important when we would like to swallow. So it have to be, every mucosa have to be slippery and shiny and also wet, which is very important. Let's talk about the fat. The supply of lipids, compact form of energy. So this is one source of energy. Essential fatty acids necessary for the synthesis of lipid molecules in the body, which is also very important if we think about the cell membranes, because it's formed from lipoproteins, you know, also. Fat-soluble vitamins which will not be obtained naturally unless there are fats in the diet. So we need fat in the diet because otherwise the vitamin A, vitamin D cannot enter in the human system. So that's why some fat is necessary. Inadequate in fats can be the result of vitamin deficiencies, poor calcification of dentin, some lipids essential for the calcification. Especially that period when the primary teeth and also that period when the permanent teeth are developing in the bone, it's necessary enough lipid and basically some lipid is essential for the calcification. Yes, the carbohydrate, the main energy source is the carbohydrate. Deficiency of the carbohydrate is simple energy deficit. And the carbohydrate has another action, you know, it's carcinogen. Not every kind of carbohydrate, but for example the glucose, galactose, so which is can be the source of energy and can be fermentable for the bacteria, for example the Streptococcus mutans and also the Lactobacillus acidophilus. And what kind of bacteria you can find on the root surface?
Oh, you mean the one that eats those breakdown products from the previous bacteria, you mean?
Basically, rather, so, actinomyces, yes, yeah, you are right, actinomyces viscosus. That's right. First time on the enamel surface, rather so the Streptococcus mutans is the main bacteria which will break down these carbohydrates. and make organic acids. This is the main problem, you know. It produces, for example, lactic acid and butter acid, so different kind of acids, and that will cause that the pH will be lower and lower, so we reach the critical pH on the surface of the tooth, and under the critical pH, it's starting the mechanism of demineralization, and this demineralization ratio will be higher than the remineralization. This is the main problem, you know. So what is the critical pH? Can you tell me?
4%.
4 it's too low. So
5.5.
it's 5.2, 5.5, between 5.7, basically 5.5 is, this is that point which under it, it's rather demineralization, okay? So that's why the long-lasting acidic environment is not good on the tooth surface. That's why we brush our teeth daily, twice or 3 times. It depends on the situation, but it's necessary. Not to be plaque on the tooth surface. Always in the plaque there are a lot of bacteria which can break down the carbohydrates. Yes, if we have plaque, we have bacteria and we have carbohydrates also. It's not good. It leads to caries. That's why the dental flossing is very important, because between the teeth, proximal areas, yes, under the contact point, a lot of accumulation of plaque can be. Even if you brush your teeth, I have some patient, many of patient don't use the dental floss because they don't like it, and always they have proximal caries. After half a year they are coming back, they are always wondering why, but I tell them that just the brushing is not enough. It's not enough. Okay, let's talk about the vitamins, the most important vitamins, because the seminar is about rather the vitamins, so all of the vitamins we will talk about, okay? These are which are most important in the oral cavity. There are 2 groups, so the water-soluble and lipid-soluble vitamins. Excess of water-soluble vitamins is rare. Excess of lipid-soluble vitamins is harmful and it can happen, especially the A and D vitamin. Exception vitamin B6 can produce harmful effects when taken in excess. So vitamin B group, diver group, function as a metabolic intermediaries or regulators of red blood cell development. So the B2 riboflavin is precursor of the oxidation and reduction coenzymes. Oral symptoms can be a pallor of the lips, loss of epithelium, and give the red shiny appearance described as cheilosis in this case. And mark at the angles of the mouth, this is the angular cheilitis. So in this case always you can see an angular cheilitis, so an inflammation in the corner of the mouth. It's very common happen if the B2 riboflavin is not enough. The B12, the cyanocobalamin, which contains cobalt, basically it's a special vitamin, and the folic acid deficiencies both result megaloblastic anemia. In some cases, in this case, the tongue is depopulated and shiny in this case. Vitamin C is an important vitamin basically because take part in the synthesis of collagen, the collagen fibers. So this is the ascorbic acid. It's a powerful antioxidant, essential for the formation of collagen. This is the most important. Collagen is a vital part of all connective tissue and component of the matrix of bone, dentin, and cementum. So also in formation of the dentin and tooth development, it's very important. Deficiency manifesting as a scurvy, acute deficiency, swelling, redness of the interdental papillae, spontaneous bleeding of the gums, you can see, and poor wound healing is very, very common happen. And if it's long lasting, we have scurvy. Can happen that periodontologically, so the periodontium is destroyed and inflamed, and the patient will have loose and basically mobile teeth. Yes, it's mobilization of the teeth, and after they will lose it. So it was in the historical time. It was the defects and deficiencies of the sailors. They will go a long trip, shipping and sailing, and they not eat any kind of foods which contains vitamin C. and it was a sailor disease. Nowadays it's very rare. Scurvy, basically red swollen bleeding gums, petechial bleeding in the skin, so not just the oral cavity you can see inflammation. You can see petechias in case of the skin, because the small capillaries also contains collagen fibers, but they are very fragile in this case. So if you hit your hand or the skin, it suddenly has bleeding, because not enough strong the wall of the small blood vessels basically. Teeth become loose in their sockets. Bone fracture can happen because also in the bone we can find collagen fibers, and the structure of the bone is also full of collagen. The fracture heals very poorly. It's happened. Where we can find vitamin C? Basically fresh fruits and vegetables, especially the citric fruits, so the lemon, orange, grapefruit and so on you can find, and the paprika. Think about in the paprika also a lot of vitamin C. Rose hip, it's also another
What? Rose?
rose hip. It's a special, the wild rose.
Yeah.
The wild rose has, basically before it has flower, it has a hip.
Onion, you mean?
I will show picture the next other seminar, okay?
Because I do gardening, I'm like, what?
In Hungary they use it, collect it
Yeah.
and make tea from this, for example.
No way.
Yes,
Oh,
yes.
I will later.
Older members, for example, the old peoples collect it, and after they press it and make, for example, tea from this, and it contains a lot of vitamin C. It's useful. But if you eat any kind of lemon and orange, so citric fruits, it's enough, I think. Yes, but you have to know that if you cook it, you lose one part of the, yes, rosehip, that's it.
Oh, those, yeah.
Yes.
Yeah, they grow everywhere in Holland.
Yes,
Yeah,
yes,
yeah,
yes.
yeah.
In Hungary you can find it everywhere. I don't know other countries, how is it?
Jam we have.
Yes, jam, yes, of
Yeah, yeah.
course, in jam also, it's very fine, yes. And also tea, you can buy this kind of tea. But if you cook it, basically, you lose one part of the vitamin C. So some of them you can find it, but you can reduce it with the cooking, okay? So, and also if you use it and cook it in a metal dish, also it can a little bit reduce the concentration of it. And also it's antioxidant, and it's very useful vitamin, because there are some oxidants which can cause cell destruction and can cause the destruction of the DNA, okay? And it's antioxidant also, so the free radicals can neutralize basically. The vitamin A is fat soluble vitamin. Vitamin A, D and K have important roles in ratio of the health in the oral tissues. So vitamin A is retinol, essential for the maturation and differentiation of epithelial tissues. Lack of vitamin A leads to hyperkeratosis of the mucosa, and the salivary glands are subject to hyperplasia of both acini and ducts. So basically, in this case, can be lack of saliva. So oral mouth syndrome can happen, which is not good. Like in case of the SLE, the systemic lupus erythematosus, you know. Keratin plaques may obstruct the ducts, so that's why cannot flow the saliva, cannot from the parotid salivary glands. Reduce the salivary flow, and basically in this case it will be increased caries susceptibility. So you will have more rate of caries of this patient, will happen easier the caries, because the saliva is protected this, you know. Deficiency, basically the odontoblast atrophy can happen in lack of vitamin A. Poor dentin formation, so the structure of the dentin will be weaker, and also it's less resistant against the acid and more larger rate of the caries. Retinoic acid, a derivative of vitamin A, powerful growth factor, cause regression of some skin cancers. Essential for the normal absorption of calcium from the small intestine and the formation of removal of bone, so this is the vitamin D. Lack of the vitamin result in low levels plasma calcium, calcium not available for bone deposition, resulting in large amount of osteoid, plus bone resorption manifested clinically in the children as rickets, and in adults as osteotis fibrosis cystica. So rather, the vitamin D cause problem in case of the bone, the skeletal system, not just in the legs and the arms, also in the chest can problem, especially in the developmental period. In childhood, it's more harmful. It is. So excess of vitamin D leads to hypercalcemia and ectopic calcification, and sometimes can happen the PAP calcification. Also easier happen. Have you heard about PAP stone?
That's that, yeah.
Pauper. So in this case, you can find hypercalcification in the PAP chamber. It's not good because
They are more readily absorbed on X-rays, we can recognize.
yes, you can see on the X-ray. We have some cases, endodontic cases, and in this case, very difficult to find the root canal. Sometimes impossible at
It's covered,
first.
yeah.
Yes, you have to remove at first the calcification. So it can be if you have too much vitamin D. Not just here, but in case of the teeth, it also can happen. In this case, we have special sonic instrument, and we vibrate it, and we try to remove this calcification, and after we can try to find the canals, the root canals. So it's important and it's useful to know it. Vitamin K, it's melatonin and meladion, essential for the synthesis of the blood clotting factors. Deficiencies result in the failure of blood to clot and increased clotting time if you have not enough vitamin K. Also, we have to talk about the minerals, the calcium phosphate, the calcification. In case of the calcification of the teeth, it's very important, and also in the bone. Low intake of calcium or phosphorus or both might lead to poor calcification of teeth and increased risk of dental caries. The effect is limited to dentin formation, increased thickness and predentin layer, and increased and interglobular dentin, resulting in high carbonate apatite, which is not good. This is more soluble in acid, so it's not so resistant as the fluorapatite and the hydroxylapatite. The carbonate apatite is not good.
Brittle.
Brittle, yes, of course, it's very brittle and not acid resistant. So the hydroxylapatite is more resistant, and the best is the fluorapatite. We will talk about because the fluoride will be the next topic. Not now, next week. If the fluoride built in the enamel, it's more resistant against the acidic environment. As I remember, there was an advertisement in the television when with the fluoride they cover an egg, and after that the normal egg, and the covered egg put in acid, and which was not handled with fluoride. It was soft after a little time, but the other was still hard because it's not acid soluble. Also, we need a little magnesium. It's essential for the calcification of the dentin, the normal calcification of the dentin. Deficiency is rare because everybody take any kind of magnesium. The Magna B6 maybe, you know. Sometimes it's good in exam period when you are a little bit more stressful. It helps a little bit regenerate the nerves.
True.
Yes,
Yeah.
it's true and it's working. Not basically it's not a wonder, but it's good. It's absolutely good. It's working.
In the evening, take one. Usually.
Again, please.
It's like in the evening and then sleep and then next morning.
Yes, you can sleep easier a little
Yeah.
bit, and the regeneration
I
of the
take
nerves
it
are
every
better.
evening.
Yes. It's good. Iron deficiency is fairly observed in young women and pregnancy. The anemia may be recognized by the pale color of the gingiva and other oral tissue, and sometimes the face. If it's pale a little bit, you can think about anemia. And also the skin everywhere. if you know that person and you know that not every time the color is different, you know, because sometimes if paler can be the cause of anemia. The proper supply of oxygen to the oral soft tissue leaves them more susceptible to injury and infection. Loss of papillae on the tongue surface is probably manifestation of this. So in case of anemia also you can see that no papillae on the tongue surface, depapillated, so in anemia. I don't know why, but in this case it's a reduction of the papillae. Normally if you see, that's why the general practitioner doctors always see the tongue surface. To see, for example, the surface of the tongue. The color, the population, and also the debris on it shows what kind of problem can be behind it. Also we have to talk about the trace elements. The fluoride is the most important trace element in the dentistry, you know, because if it build in and change the hydroxyl group for fluoride, it will be a fluorapatite and it's much more resistant against the acidic environment, and the fluoride has another systemic effect. So if in childhood the patient, so if the child will get enough fluoride, basically the morphology of the tooth will be a little bit different. Won't be so deep fissure system. It was research, and it shows that if we have enough fluoride, when the teeth are developing, the fissure system won't be so deep and won't be so retentive, and the cusp won't be so high. So a little bit easier morphology will developing with the help of fluoride. Molybdenum, boron, and strontium are associated with low caries level. Not exactly we know why, but it was research. Selenium, vanadium are associated with high caries level. The mechanism is not exactly clear today, but they have some effect of the caries. Diet and the dental caries. We have to talk about the erosion. So different kind of foodstuffs can be harmful on the enamel. Acidic foods, liquids may dissolve the opposite surface. The erosion you have to talk about. We will have a special lecture on 5th year about the dentin hypersensitivity when we talk about these problems. But the erosion is not good. So if you eat any kind of acidic foods, I recommend you not to brush your teeth suddenly, okay? Because when you eat it, yes, it's etching. That's right. It's etching. Absolutely. Because in this case, it softens the enamel. So demineralize the enamel. We have to wait 1.5, basically half an hour. It's enough. And you have to drink some neutralizers, and just after toothbrushing. Otherwise, you will brush away your enamel, and it will be erosion. Many young people has this problem, as I see. Yes, the dental caries we talk about, and it's very important what eaten, how often, and how many times a day. So basically, if we eat collagen foods, it's better if we eat it connecting to the main eating. So connecting to the dinner, connecting to the lunch. Okay, not separately, not everywhere to eat. It's not good. If between the main eatings we eat sweets, we have more chance for caries developing, you know. Because in this case, the substrate is always available for the bacteria. But if we eat, for example, sweets and candies after, for example, the dinner, evening time, and after we brush our teeth, it's better. High intakes of specific carbohydrates, sucrose, associated with high caries incidence. For the sucrose is the most important and the most harmful. The glucose, galactose, and the others are not so. And you know there are some alternative sweeteners. Have you heard about xylitol, for example? Acidity in the chewing gum you can find that it's useful because the bacteria cannot break down, cannot fermentate it. So it's sweet, but basically it's not fermentable, so it's not carcinogen. We can use this kind of alternative sweeteners, but they are much more expensive. And the other problem, if you use in high rates, it will cause some problem, you know. So after you will have it's laxative. So the main problem, yes, it's laxative. This is the main problem of this. Okay, so in high rate, not to use it. It's uncomfortable a little bit. And some foods stimulate the flow of saliva, which wash them away and neutralize their effect. So the oral clearance is very important. For example, chewing gum I was talking about now. It's activate and also stimulate a little bit the saliva glands, and the saliva flow is a little bit higher if we use chewing gum. And the oral clearance of the foods, it's easier happen. And also the consistency of the food is very important. If it's sticky, for example the caramella, it has a long oral clearance. So it's a substrate, a long-lasting substrate on the tooth surface. So in case of the children, it's useful if you not give this kind of candies for the children, okay? Because the primary teeth are much more easier starting the caries, and weaker than the permanent teeth, and it's very easier, very easy way start to be a caries. I would like to show you some, it's not so important animal studies. But there was germ-free animals showed that caries was a bacterial disease. The main bacteria were the mutant streptococcus. That animals which was germ-free, no, it was no any kind of bacteria, no streptococcus mutans, and we gave them carbohydrates, the same kind of sucrose and very dangerous carbohydrates, not happened any caries, because absolutely we need bacteria for the caries. Only just the carbohydrate won't cause caries. Do you know which is the Stephen curvature? The Stephen curvature. The Stephen curvature will shows how is the pH after time is going down or up. So this is the Stephen curvature. Chocolate, bread, cookie, and apple, if you see. And this is the line of the critical pH. After a little time, in this case, the acidic environment will be and the pH will be lower and lower. If normally, if you eat, for example, the B is maybe this is the chocolate, the pH will be go down. These are harmful foodstuffs. There are some foodstuffs which are associated with lower caries levels. The acids taste stimulates the salivary flow and increase the salivary buffering, and the high calcium content lowers the solubility of a diet. For example, in the case of the cheese, it's caries protective foodstuff. It's not carcinogen foodstuff. If you see the Stephen curvature will not go below the critical pH. If you eat cheese, it's not painful, it's not harmful for you. Yes, you can see different kind of food stuff. Hamburger and rice, it's not so serious, dangerous, but the chocolate cream, it's dangerous, and sucrose, it's also dangerous. If we eat some waxy foods, also better. The chocolate, it's a little bit better than other kind of candies because the butter, there is an oily component of the chocolate which is a little bit cover the tooth surface, you know. as I know, the butyric oil may be in the chocolate. There is an oilic material in the chocolate which cover the tooth surface and won't happen this demineralization effect in case of the chocolate. So rather eat chocolate, okay? Not other kind of candies because they are more dangerous. Shortly it was, okay, the lecture. Any question about it?